Welcome back. I'm here with Dr. Maheshwari with Richmond Gastroenterology. He's here to talk to us because March is Colorectal Cancer Awareness Month. So tell us more about the importance of this month.
Well, first of all, thank you for having me here today.
Yes.
I'm glad to be here talking about this. So, you know, March is Colon Cancer Awareness Month. Colon cancer is a big deal in our country because in men, colon cancer is the third most common cause of cancer-related death. In women, it's the fourth most common cause. If you combine those two statistics, it's the second most common cause of cancer-related deaths behind lung cancer.
Oh, wow. Wow. And tell us more about Richmond Gastroenterology Associates.
So Richmond Gastroenterology is the group that I work with, as you can see right here. And we're a group of 19 physicians and 12 advanced practice providers. That means physician assistants and NPs. And nurse practitioners. We serve the greater Richmond area, including kind of the Petersburg and Colonial Heights area. We provide gastrointestinal and liver-related care, whether it be your GERD, colon cancer screenings, Crohn's, ulcerative colitis care. We can handle all of that.
Wow. And when would you recommend screening?
Well, it depends, Azraya. If you're average risk or you're high risk. So if you're average risk, the US PSTF, which handles the screening guidelines in kind of all of our screening guidelines, they recommend at the age of 45 if you're average risk, meaning there's no family history of colon cancer. If you are at a high risk, which means a family history of colon cancer, or you have various conditions such as Crohn's and ulcerative colitis, primary sclerosing cholangitis, not to get too technical, but these would necessitate sooner colonoscopies. In somebody with a family history of colon cancer, especially in your parents, children, or a sibling, then it would be 10 years before the age of earliest diagnosis or at the age of 40, whichever comes first.
And talk to us about the importance of these screenings as well, too.
And it's important because we can catch colon cancer early and we can prevent any polyps or these growths in the colon. We can actually take them out during the colonoscopy. And that's why it's important to get screened, that even if we do find colon cancer, we'll find it before it is spread to the rest of the body. And you know, it can be cured right then and there.
Wow. And also, can you talk to us about some common myths when it comes to colonoscopies that might scare someone away?
The most common myth is that you're awake for the procedure. So for those who have had the colonoscopies, they know you're laying on your left side, a camera on the end of a flexible tube, the colonoscope, is inserted through the rectum, and we go around and look for any polyps or cancers. And if there's any polyps we can take out, we take it out right then and there. If there's nothing, then there's nothing. And then you can come back after a certain time. But the biggest misconception is, and it seems to be a spread from maybe back from 30, 40 years ago when these procedures were first being done, they were done with little sedation at the time. Now we work with anesthesiology to provide sedation, and most people say it's the best nap they've had in a while.
And where are your locations at?
So I personally practice out of our Midlothian offices just down the street from the studio, actually.
Oh, wow.
About in the Wadsworth area. We also have locations in Mechanicsville, as well as our new West Creek location in the near Short Plum Town Center.
And where can folks find more information and book themselves an appointment as well, too?
Well, you can, the website's richmondgastro.com. You can Google Richmond Gastroenterology Associates, and we'll have all our contact information there.
All right, well, thank you so much for joining us. One more tour about town coming up after the break.